Hello, I'm Akuna Cook, Deputy Assistant Secretary of State for African Affairs. I had the privilege of starting my career at the Department of State. I have also had the privilege of spending much of my career as a diplomat, lawyer, and in the nonprofit sector, working towards progress for people of African descent. And as a daughter of Nigerian immigrants, I am thrilled to return to government to serve in the Biden-Harris administration. 58 years ago, at the first meeting of the Organization of African Unity on May 25, 1963, representatives of 30 African nations gathered to form a new body to help bring about freedom, self-determination, independence, and change to African countries. In 2002, this organization transformed itself into the African Union, with objectives that have continued to evolve and expand over the decades. Each year on May 25th, Africa Day is an opportunity for us to reflect on our relationships with our African partners and on our shared priorities and successes. The United States and the African Union today partner together on a wide range of issues, including advancing peace and security in Africa, promoting economic growth, trade and investment, strengthening democracy and governance, and promoting opportunity and development in Africa. These four pillars of engagement serve as the foundation of the strategic partnership between the United States and the African Union Commission, and they remain guiding principles for our cooperation. In areas such as economic development, for example, the United States has worked alongside the African Union Commission to support implementation of the African Continental Free Trade Area. And in health, we have worked hand in hand through the African Centers for Disease Control and Prevention since 2016, as it has stood up efforts to prevent, detect, and respond to outbreaks of infectious diseases on the continent, create an emergency operations center, and train epidemiologists and incident managers. Our investment in public health in Africa is another example of the enduring U.S.-Africa relationship and remains a key priority for the United States government in Africa. Even if it weren't abundantly clear before this past year, COVID-19 has forced us all to realize just how much we depend on global health security. Not only reduced mortality, but improved living standards, educational progress, economic growth and development, good governance, and ultimately, peace and security. Public health is truly the foundation of society, which is why the United States has invested so significantly in public health in Africa, topping more than $100 billion over the past 20 years. These investments have not only saved millions of lives and improved the quality of life for millions more, but also they have strengthened African health systems, making them more resilient and able to address both existing health challenges and emerging threats, such as COVID-19. For example, the President's Emergency Plan for AIDS Relief, or PEPFAR, has not only saved over 20 million lives, but also has invested billions of dollars to strengthen significantly the capacity of healthcare laboratories, workforce, and supply chains on the African continent. And it does this in partnership with host nations, the private sector, and civil society, working together to identify and build capacity in key service delivery areas. Today, I invite you to learn more about how our partnerships, such as the one that PEPFAR has created between American institutions like my alma mater, Howard University, and Charles R. Drew University, and African institutions like the Ministry of Health in Zambia, that are enhancing the capability of our African partners to control their HIV epidemics and address other healthcare needs and challenges facing their people. On Africa Day and every day, we thank those who work tirelessly to help achieve our shared vision of a peaceful, secure, and prosperous Africa. As President Biden has said, we believe in the nations of Africa. The United States stands ready to be a partner to you in solidarity, support, and mutual respect, and we join you today in celebrating Africa Day. Thank you.
In 2003, the world was reeling from the devastating HIV pandemic. Millions of people had lost their lives, and many children were orphaned. That year, former President George W. Bush initiated the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR. It has been one of the greatest achievements of the United States engagement around the world, especially in Africa. In 2004, when PEPFAR arrived in Zambia, there were fewer than 15,000 Zambians on life-saving antiretroviral therapy, and the cost and access to treatment was insurmountable for many. Today, thanks to the generosity of the American people, more than 1.1 million Zambians are on life-saving treatment. Average life expectancy for Zambians has increased by 20 years, from 44 years in early 2003 to 64 years in 2019. That's extraordinary. PEPFAR is the largest example of U.S. health diplomacy in Zambia and a foundation of the U.S.-Zambia bilateral relationship. With an annual budget of more than $400 million, the PEPFAR interagency team provides HIV treatment, prevention, and voluntary medical male circumcision, and it builds technical skills across the Zambian health sector through health diplomacy and partnership with the Zambian government. The hard work and interagency collaboration of the U.S. Agency for International Development, the U.S. Centers for Disease Control and Prevention, the Department of State, the Department of Defense, the Peace Corps, and the Health Resources and Service Administration, or HRSA, have propelled Zambians to the verge of HIV epidemic control. Today, we are recognizing the partnership of HRSA and the Global Health Consortium of the Historically Black Colleges and Universities, of HBCUs, which began in 2017. This partnership has furthered our cooperation over the last 5 years. The 4 HBCUs that make up the consortium, the Charles R. Drew University of Medicine and Science, Meharry Medical College, Morehouse School of Medicine, and Howard University, are having an impact in Zambia every day by building the capacity of the Zambian workforce, reducing cultural stigma, and strengthening health systems. Let me give a few specific examples of HRSA and HBCU's consortium's contributions. Through the Charles R. Drew University of Medicine and Science Rise Up project, PEPFAR-funded Rise Up houses offer a youth-focused and youth-friendly environment where at-risk girls and young women living with HIV can comfortably receive services. The Meharry Medical College provides training and mentoring to clinicians in maternal and child health units to improve their practice and the health outcomes of infants, children, and mothers receiving ART therapy. The Morehouse School of Medicine is supporting the creation and rollout of a telemedicine program to strengthen access to HIV services, particularly for those most vulnerable, for whom traveling to obtain care may be difficult. And Howard University is building the capacity of PEPFAR-supported sites to implement a fast-track model for stable adult patients to decrease facility congestion, decrease waiting time, improve adherence, support linkage to care, and increase viral load suppression. It is clear from these brief examples that the HBCU consortium is helping support Zambia to achieve and maintain epidemic control and build lasting practices to support Zambia today and tomorrow. On this, the celebration of African Freedom Day, it's my honor to recognize the contributions and achievements we have made to strengthening Zambia's national HIV response. We celebrate the achievement of more than 1.1 million Zambians on HIV therapy, thanks to the contributions of the American people, as well as untold numbers of HIV infections that have been prevented. We also remember those lost to the pandemic, and today we reinvigorate our commitment to advance health security in Zambia, an example of the enduring U.S.-Africa relationship. Thank you.
Sincere thanks to Deputy Assistant Secretary Cook and Charge David Young, who eloquently stated in their opening remarks, the partnership between the United States and Africa is long-standing and strong. Greetings, my name is Mamadi Yella. I am the Deputy Coordinator for Multi-Sector Relations in the Secretary's Office of the U.S. Global AIDS Coordinator and Health Diplomacy at the U.S. Department of State. It is a pleasure to be here with you watching from around the world to commemorate Africa Day. Over the past 18 years, the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, has been a pillar of this partnership. To date, PEPFAR has invested more than $85 billion in the global AIDS response, the vast majority of this in Africa. enabled by strong bipartisan support across multiple US Congresses and presidential administration, and through our enduring partnership with African countries and communities, PEPFAR has helped save over 20 million lives, prevented millions of HIV infections, and significantly strengthened pandemic preparedness around the world. PEPFAR also demonstrates the remarkable power of partnerships built on mutual respect, accountability, and shared values, such as we have across Africa. Through our work together, several African countries have achieved HIV epidemic control, and many others are on pace to reach that goal soon. PEPFAR investments have not only helped transform the HIV response across Africa, but we have collaborated to significantly strengthen the infrastructure and capacity of health systems to prevent, detect, and respond to a diversity of other urgent health threats, such as tuberculosis, H1N1, Ebola, cholera, and now COVID-19. PEPFAR invests nearly $1 billion in annual direct health systems investments. We have helped train nearly 300,000 healthcare workers, support 3,000 laboratories, and assist clinical operations in 70,000 healthcare facilities, again, the vast majority in Africa. PEPFAR is managed and overseen by the US Department of State's Office of the US Global AIDS Coordinator in Health Diplomacy, leveraging the power of a whole-of-government approach to controlling the global HIV/AIDS pandemic. PEPFAR is implemented by 7 other US government departments and agencies. Together, we have made remarkable progress, but our work is not yet finished. The AIDS pandemic and other global health challenges constantly evolve in every community and country, and PEPFAR continually works to adapt and innovate to optimally serve our clients and partners. In commemoration of Africa Day, today's virtual program, the US and Africa, Partnering and Innovating to Achieve HIV Epidemic Control and Strengthen Global Health Security, will highlight the US government's substantial investments in HIV and health system strengthening across Africa, and specifically our partnership with the Republic of Zambia. This virtual program will showcase how the US government leverages the expertise of key partners like historical Black colleges and universities in the HIV response in Africa under the HBCU Global Health Consortium. We have a great set of speakers with us today, so without further ado, let's get started. Joining us from Zambia, we are proud to have a senior member of the Republic of Zambia's Ministry of Health, Dr. Conciti Mwale, who will provide remarks, followed by remarks from each of our other panelists. So over to you, Dr. Mwale.
Good morning and welcome to Lusaka Provincial Health Office. My name is Dr. Mwale Conciti, working as Provincial Health Director for the last 4 years under Lusaka Provincial Health Office. Zambia's current prevalence for HIV and AIDS stands at 11.1%, and Lusaka Province HIV prevalence stands at 15.1%. Currently, we have a total of 473 health facilities dotted across Lusaka Province, where we are providing various types of HIV and AIDS services. And through these health facilities under Lusaka Province, we have been able to partner with a consortium of historically Black colleges and universities. Among some of the high impact results that I would like to share with you is 1, the patient waiting time, 2, the 6-month monthly dispensing, and 3, maternal and child health services. When we started providing HIV and AIDS services under this partnership, we noted that we were able to manage the patient average waiting time by having it reduced from as high as 5 hours to less than 1 hour in the facilities where we are working with the consortium. We have also managed to integrate maternal child health services for people living with HIV and AIDS and the well child under the facilities where we have partnered to ensure that we provide HIV and AIDS services at the same time that we are also managing and providing antenatal as well as maternal child health services for the well child. I'm also happy to mention that we provide what we call DSD service models for the stable patients, and through this we have managed to reduce the contact time for patients who are living with HIV and AIDS in these times of the high COVID prevalence in our country or the COVID-19 pandemic. Allow me also to mention that we have managed to put almost 100% of our clients who are on HIV and AIDS treatment on 6-month monthly dispensation here in Lusaka province as well as Copperbelt province. Because of the successes recorded under the consortium, we have managed to now expand to the Copperbelt province where similar models of HIV and AIDS service provision are going to be implemented. One key model is that of the Rise Up program, which targets adolescents as well as young girls and young women who are aged 15 and 24 years and are living with HIV and AIDS. These are able to be identified, linked up to care, and retained in care through the Rise Up program, which has been very successful in Lusaka, where we have enrolled so far a total of 1,972 adolescent women and young girls who are living with HIV and AIDS. I want to thank our partners through the United States government and the Zambian government for ensuring that our partnership through the consortium is successful and is providing high impact interventions. Thank you.
So thank you so much, Dr. Mwale, for highlighting this incredible partnership between the US government and the government of Zambia through the HBCU consortium. Well, that consortium and its work is possible because PEPFAR first partnered with HRSA. So I'm pleased to welcome our first live panelists today, Dr. Addis Tasoya, to actually speak about HRSA's work. Over to you.
Thank you very much, Mama D. Greetings and welcome to everyone. It is my utmost pleasure to be here today. And I want to say thank you to the Zambian Ministry of Health for those comments. We truly value our partnership and the work we do together to impact lives in Zambia. The Health Resources and Services Administration, otherwise known as HRSA, is the primary US federal agency for improving healthcare of those who are geographically isolated or economically or medically vulnerable. HRSA programs help those in need of high quality primary health care, people living with HIV and AIDS, pregnant women, and mothers. HRSA also supports the training of health professionals, the distribution of providers to areas where they are needed the most, and continuous quality improvements in healthcare delivery. Specific to HIV and AIDS, HRSA implements the Ryan White HIV/AIDS program in the United States, which provides a comprehensive system of HIV primary medical care, essential wraparound support services, and medications for low-income people living with HIV. In the United States, 1 of every 2 people diagnosed with HIV receive services through HRSA. This means HRSA is providing care to more than 500,000 people each year in the United States. Over the last 3 decades, HRSA's Ryan White HIV/AIDS program has played a critical role in the United States' national public health response to HIV with great success. Program data demonstrate improved health outcomes and reduced HIV transmission among hardest to reach populations. In PEPFAR, HRSA has invested its allocated resources in utilizing the knowledge gained from the domestic success to inform and support adaptive global approaches that improve health systems and healthcare delivery. Our supported activities ensure the provision of high quality care through capacity development and strengthening, workforce development, and local community leadership, utilizing innovative, sustainable, and transformative approaches that enable individuals and communities to thrive. HRSA has leveraged its domestic experience and remarkable success to work in close partnership with the Zambia Ministry of Health and ensure people living with HIV get the quality services they need to live healthy and productive lives. HRSA has a successful history of working with historically Black colleges and universities, HBCUs, to provide much needed care throughout the United States. In 2017, the HBCU Global Health Consortium, funded by PEPFAR through HRSA, was established to address the social determinants that can lead to health inequalities and impact the care and health outcomes of patients in the Zambian healthcare system. This Global Health Consortium brings the lessons learned from the HBCU's work in the United States to Zambia, working in partnership with the Zambian Ministry of Health to help address the HIV epidemic there. The HBCU Global Health Consortium is a partnership of 4 HBCUs: the Charles R. Drew University of Medicine and Science, the Meharry Medical College, the Howard University School of Medicine, and the Morehouse School of Medicine. The HBCU Global Health Consortium as a whole has a wealth of experience and expertise, conducting a diverse range of HIV and AIDS projects, particularly activities with minority populations in the United States, as well as in African countries disproportionately impacted and affected by HIV and AIDS. Each of the 4 HBCU partner medical schools brings specific expertise to implementation, ultimately to contribute to the goal of ending the global HIV/AIDS epidemic. All of the HBCUs use a differentiated service delivery or DSD model in their approach to supporting patients in Zambia, along with other PEPFAR partners. Howard University's work, for example, which you will hear more details about today, utilizes increased touch points with patients and efficiencies in clinic flow and other aspects of care to provide a care experience that helps to prevent treatment interruption. You will also hear more today about the work of Charles Drew University, which focuses on adolescent girls and young women as a priority population that deserves additional support because of their high risk of HIV infection, and ensures that services are tailored for effective prevention and their care needs. Before we discuss Howard and CDU's work in more depth today, I wanted to highlight the work of the other 2 Global Health Consortium members. The Morehouse School of Medicine is implementing an innovative telehealth program within Lusaka District's 4 first-level hospitals. The telemedicine activity includes 13 sites. The 4 first-level hospitals, along with the University Teaching Hospital, and 8 down referral sites at satellite locations of those 4 first-level hospitals. The goal of the Zambian telemedicine model is to bring healthcare delivery directly to the patient in the community. This will reduce the burden on the patient, decongest the hospitals, and help with the COVID-19 public health emergency response. The Meharry Medical College has supported the Ministry of Health to develop a one-stop shop DSD program within the maternal child health unit at 4 first-level hospitals in Lusaka. The design of the maternal and child health DSD model encourages family-centered care to identify and support HIV-positive mothers and their babies by testing and tracking HIV-exposed infants, as well as providing immediate supportive services for infants that are identified as HIV positive. This model provides comprehensive wraparound services for moms and babies that recognizes their individual needs and provides peer and community support, including HIV treatment. Finally, the HBCU Global Health Consortium is also in the process of developing a program in Malawi that will build on the successful US-based programs of the HBCUs that train youth to enter the health field as community health workers. In collaboration with the Malawi Ministry of Health, a similar program is being tailored for the Malawi context. This program will provide adolescent girls and young women who have participated in the DREAMS, which is the Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe Partnership, with training leading to employment opportunities and an increase in the number of community health workers available to provide critical, essential, and HIV/AIDS services in Malawi. Back to you, Mamadi.
Thank you so much, Dr. Ade, for spelling out for us so articulately the HBCU Consortium's partnership with HRSA and with the government of Zambia. It is now my pleasure to welcome one of those HBCUs represented today by Dr. Celia Maxwell from Howard University. So over to you, Dr. Maxwell.
Good morning. Thank you, Dr. Yila, for that kind introduction. I am Dr. Celia Maxwell, a professor of medicine and infectious diseases, and one of the co-principal investigators, along with Dr. Henry Fomandan, of the Zambia Project. Dr. Fomandan is currently also the regional director of this and for 8 of our previously funded PEPFAR projects. As you may know, for more than a decade, Howard University has directed PEPFAR-funded projects in high-burden areas of 12 countries. Additionally, we have partnered with other development entities and collaborated with ministries of health and other branches of the government in these countries, including the private sector, in order to mitigate HIV and AIDS. We believe that the benefit of our partnership with the United States government includes our overall cultural competency and the ability to create avenues to share tried and tested best practices in HIV management through various projects in the US and Africa. Howard University, as part of the HBCU Consortium, is contributing towards meeting the UNAIDS 90-90-90 and now 95-95-95 targets in Zambia. The focus has been on quality assurance improvement and practice transformation, taking into consideration the social determinants of health, especially in high-volume HIV facilities in Zambia. A baseline assessment that was conducted at the inception of the project demonstrated severe operational, human resources, competency, and program monitoring challenges in these facilities. In collaboration with the Ministry of Health, we embarked on addressing these challenges through an improved and innovative differentiated service delivery called DSD+. This required improving patient flow in all facilities to decrease congestion and waiting time, as well as implementing competency training, particularly for the frontline staff. At the inception, we separated the stable from unstable or new HIV-infected patients. This was done in order to streamline service delivery. Furthermore, we assisted in the development of several standard operational procedures jointly with the Ministry of Health. These measures enable the standardization of care and strengthen program monitoring, including the application of treatment tracing through pharmacovigilance. This was a concern that the Ministry of Health had expressed to the consortium as a need. Subsequently, the DSD Plus program has become the recommended model for the country, along with its pioneer site, Matero Hospital, which currently serves as the prototype training facility for DSD Plus. Working closely with the Ministry of Health, we have decreased the congestion in the hospital, we have increased linkage to care and adherence with recommended regimen. These efforts have resulted in a viral load suppression rate of 98% at our flagship sites and decreased missed appointment rates to approximately 1%. Furthermore, we reduced waiting time from 6 hours for medication collection and 8 hours for clinical checkups to less than 1 hour for both. As a result, we established the first functional fast-track clinic, which offers a comprehensive package of HIV care at Matero Hospital. I thank you very much for your attention, and I look forward to expounding more on the activities that Howard is participating in Zambia during the question and answer segment.
Thank you so much, Dr. Maxwell. Really appreciated getting to hear those details of Howard's partnership in Zambia. I am thrilled actually about our next speaker. In 2019, we joined Zambia's First Lady, to visit Rise Up. And one of the comments she made after visiting the girls at the house that day was that they needed a rise up across the country. It was so powerful to see the young ladies and just the peer interactions and the support they were receiving. So we are thrilled that one of those young ladies, Nasile, is going to share her experiences with the Rise Up program, which is supported by the HBCU consortium. So over to Nasile.
My name's Nasile Milinga, and I'm 19 years old. I was born on the 26th of October. I live in Chawama, in the community where the Rise Up was established. People would describe me as a person who is straightforward, loves simple things, and has a positive energy around people. In my own understanding, I would describe Rise Up as a platform or place for people living with HIV where they can voice out how they feel and how can they make a difference. I'm a girl who is positive, but I discovered my status in 2014, but I started taking my drugs in 2005. It has been a difficult year before I joined the Rise Up House, because when I was at a boarding school, I never used to take my medication because they were checking people's bags. So I wanted to suit the environment. So I stopped collecting my medicines and started missing my appointments. But after I stopped collecting them, I started falling sick, and I think for some time my parents decided to take me back to the hospital in Chawama. After I reached that site, I met the adolescent nurse for Rise Up, Miss Bridget, and she later on talks to me and introduced the Rise Up House program for me. At first, I thought it wouldn't be a great idea to join the group or the program, but I thought for a second maybe it might change my life, because collecting my medication from the hospital wasn't really a good idea, and a lot of people would know me, and I felt really uncomfortable. So she introduced the system of saying I can be collecting from the house. So after I agreed on collecting from the house, I got one-on-one counseling, and I started taking my medication from there, had some sessions, and I felt like, okay, it's time for me to open up, because there are people that are the same status with mine. So I then started becoming free with the environment, free with the people, and then after that I would go for sessions, and now I was really free with everyone. After I got free with everyone, they saw the ability of me that I can manage helping out with some of the programs. That was becoming a peer navigator. So I then joined being a peer navigator, and I at least learned some things there, like their stories, fit in with people. Don't pretend to be who you're not supposed to be, because if you pretend, it's not going to take you anywhere. And we already are HIV positive, so you just have to live with it. Relax. It's not the end of this year or this life. Just continue being who you are. Then I also taught them some things like self-stigma and being who they are. I also inspired them. And it's not only where we just collect our drugs or anything. We also taught each other on like how to have skills, computer lessons, movies, we learn from there, and so on. So some of the people that inspire me in life is Michelle Obama and the Vice President Kamala Harris. And not forgetting my grandpa, the person that has stood beside me my entire life, despite my mom being late. So when I really grow up, I really want to study law, or either flight, like aircraft, being a flight attendant at the University of Zambia. I would really want to help the adolescent girls out there that are HIV positive to stay strong, let them not look down on themselves and be themselves, because it's not the end of this year or this life. Thank you.
Wow, what a powerful testimony there from Nasile. And I think that one of the things I wanted to just, before we go into our round of questions, to just connect for you, our audience, is that hopefully you heard her talk about overcoming stigma and picking up her medications. And one of the things that has been really, really transformative in the partnership is having the ministry and our HBCU partners being able to get antiretrovirals for the young ladies in the house as opposed to going to the health facility. So that has improved adherence, and it's also helped to destigmatize actually taking their medications. So it's just such a wonderful example to see Nasile share her story and now how she is herself a peer navigator, encouraging other young ladies who are having to go through this experience. So we will now move into our question and answer session with our live panelists. And I would like to begin with you, Dr. Adetosaye, and pose this question to you. What makes the HBCU Global Health Consortium unique, in your opinion? And what is most exciting about its impact to date?
Thank you very much, Mamadi. I think, just watching that video is, when you see the impact on a human life is the beginning of it all, and it's the end of it all. It's like, this is what we want to do, and that's what this is all about. But in terms of the partnership, specifically, the HBCU consortium brings a very unique lens and paradigm born out of the ability to leverage their experiences from many decades of close interpersonal work with historically disadvantaged communities of color through community-based and client-centered participatory engagement, cultural congruency, and the identification of assets and communities through assessments. And I think bringing these 4 HBCU medical schools to form this consortium has resulted in PEPFAR being able to harness impactful successes from working similarly among the African American community in the United States and bring that to bear in Zambia and other countries in Africa. Building on their experience in the US, the consortium works to provide comprehensive, high-quality HIV care and treatment while also addressing social determinants of health impacting the most vulnerable populations. In 2017, when the consortium began, high-volume health facilities in urban Zambia were plagued with severe congestion, shortage of healthcare workers, low patient retention, and suboptimal viral load suppression. To address this, the consortium members worked with the Ministry of Health to undertake an assessment and identify where they could provide targeted assistance to improve the care of all patients affected by HIV in those hospitals and beyond, contributing to achieving the PEPFAR 95-95-95 targets. By focusing on clinical practice transformation and capacity building through work with frontline staff and leadership, the consortium has worked to reduce both structural and non-structural barriers that prevent patient access to HIV care. Again, as a result of their partnership with the Ministry of Health, these hospitals have been decongested. Before the Howard University program began, for example, stable patients used to wait for 4 hours or sometimes up to 5 to pick up their medications as of March 2021. A stable patient enrolled in the Howard University supported DSD program at the 4 Lusaka hospitals now waits no longer than an hour, and it's usually less. Patients who aren't eligible to enroll in a differentiated service delivery program because they aren't stable or are newly initiated on treatment used to spend over 5.5 hours getting their care in the main ART clinic. After Morehouse supported improved clinic flow and efficiency, they are in and out in less than an hour. This increased efficiency has fired up and freed up healthcare workers to attend to more patients and also reduced the burden on the patients themselves. In talking to clients, they highlight how this client-centered approach has improved their overall satisfaction, which in turn contributes to their retention and care. I think one of the most exciting things about the consortium has been its ability to partner with the Ministry of Health the way that they have done. It is a true partnership in every sense of the word. The HBCUs are working hand in hand with the hospital leadership and staff in each site, with sustainability of our efforts as the primary goal. To this end, Matero Hospital, for example, will graduate at the end of this budget year, meaning that their capacity has been developed, built, and strengthened, and external support is no longer needed from Howard University to implement that DSD program. This is a model we want to see repeated at all our sites, and it can only be done when there's a true partnership. The final major achievement I'd like to highlight before I hand it back over to you, Mamadi, is the work of Meharry Medical College. They have worked at the 4 first-level hospitals in Lusaka to expand the capacity of clinical facilities to provide HIV care and treatment to pregnant and breastfeeding mothers and their infants. By utilizing a patient-centered and family-friendly model within the maternal and child health unit at these hospitals, Meharry has achieved the following illustrative results. They've successfully implemented a pharmacy appointment system. At 4 supported hospitals, 99% of mothers who visited ANC know their status, and 100% of them who are identified as positive were put on treatment immediately. Within the first 6 months of COP20, which is this current fiscal year that we are implementing in, almost all HIV-exposed infants, about 97%, were tested at the 4 sites by 8 weeks after birth. 95% of pregnant and breastfeeding women on treatment have suppressed their viral load. And finally, they achieved an efficient clinic flow in maternal and child health by using rapid quality improvement approaches to reduce wait times and to promote improved access to HIV care for moms and babies across all facilities. It's a very exciting partnership. The uniqueness is clear and the impacts speak for themselves. Back over to you.
Well, thank you so much for those comments and descriptions. And I can tell you my firsthand experience of being at Matero and hearing from the hospital director that one of the things that he asked Howard to do was, once those waiting times had been reduced for HIV services, to help bring that to some of the other services. And you described the maternal and child health services as well. I think that's one of the things that we are most proud of from the PEPFAR side of the house, that these investments in improving the HIV/AIDS response have actually there's been a knock-on effect for other health services. And we are really, really thrilled to actually see you feature some of those improvements that have been made in other health programs. So I'm going to turn it over now to Dr. Maxwell. And coming back to Howard specifically, if you could please expound upon Howard University's efforts in Zambia. So for example, what specific health system innovations are you leveraging to support sustainable and resilient systems in Zambia to advance HIV epidemic control? Over to you, Dr. Maxwell.
Yes, thank you. Thank you so much for that question, Dr. Yila. Howard's effort has impacted more than 187,000 patients in 30 facilities and has helped to alleviate congestion in high-volume hospitals in Zambia. It has helped to increase linkage to critically needed care and definitely improved adherence to antiviral treatment. Howard University has 2 models when providing support to the Zambian health facilities. With the first model, we work very closely with the Ministry of Health to develop the flagship sites whereby intensive support is delivered. Howard provides additional healthcare workers, equipment, signage, furniture to enhance waiting areas, and training for staff. The second is a purely technical assistance, or TA model, which Howard University has employed in 20 sites within Lusaka and the southern provinces in the last 2 years. In this model, Howard provides advice and training to staff at the Ministry of Health facilities to help them to roll out a high-quality, differentiated service delivery model, particularly for stable patients, and support these sites to identify process and quality improvement measures so that they themselves can track progress. The flagship sites then are utilized as training site and models for the TA site. This structure of support has allowed Howard University to reach more facilities at a lower cost, ensuring that lessons learned from the flagships are integrated more broadly. As I mentioned in my opening remarks, Howard, in collaboration with the Ministry of Health, has embarked on addressing barriers to epidemic control by implementing an improved and innovative differentiated service delivery called DSD Plus. The DSD Plus is a model of care that enables a stable HIV patient on antiretroviral therapy to get fast-tracked services when at the hospital and to collect at the same time at least 6 months of prescription so that they don't have to return frequently. This frees up time and resources for healthcare workers to initiate new patients and manage the unstable patients. We're proud to announce that consequently, approximately 93,000 stable antiretroviral therapy patients were enrolled in Howard's DSD Plus across the 4 flagship sites and 10 technical assistance sites in the Lusaka province. Approximately 20,000 stable ART patients were enrolled in the DSD Plus across the 10 TA sites in the southern province, and now currently approximately 4,000 stable ART clients have been enrolled in the DSD Plus in the 3 flagships and 3 technical assistance sites in the Copperbelt province. Moreover, we have reduced congestion and waiting times to access ART care from 4 hours for medication pickup and 6 hours for clinical assessments to no more than an hour. Through the DSD Plus model, Howard has helped to improve antiretroviral pickup, has diminished missed appointments per month, which decreased from an average of about 242 to 5 in the flagship sites. It has also improved the continuity of treatment retention with a full 98% of ART patients on DSD retained. Furthermore, we improved the viral suppression rate. We are pleased to report that missed appointments per month have decreased from an average of over 240 to 5 in the flagship sites. There has also been improved continuity of treatment retention with a full 98% of antiretroviral therapy patients on DSD retained. Furthermore, we improved the viral suppression rate amongst those that were enrolled in the DSD Plus program. A full 98% of the antiretroviral clients in the DSD model that had viral load tests done are still virologically suppressed. As a result, the HBCU Consortium's DSD Plus model is being replicated across Zambia as a preferred DSD model, leading to the adoption of HBCU innovations by the Ministry of Health, which incorporated some of them in the 2020 national guidelines.
So thank you so much for those insights. I was keeping track of the 34,000 clients who are now able to actually get that time back and not having to return to the facility with a frequency that nobody really appreciated, or when you go to the facility, you're able to be seen so much quicker. And it's been truly transformative. And as you said, being adopted at many more sites across Zambia. So thank you so much for highlighting Howard's innovations that have been adopted by the Ministry of Health in Zambia. So let me turn again to Dr. Ade Tosaye. And Dr. Ade, I wonder, I know we sort of hinted to this earlier, but if you can comment on the health systems strengthening investments made through the HBCU Global Health Consortium project that have bolstered Zambia's capacity to address other health issues. At the top of the hour, we talked a lot about leveraging our PEPFAR investments for health security. And if you can comment on the impact of these investments on managing the COVID-19 pandemic, we'd really appreciate hearing that. Over to you.
Thank you very much, Mamadi. We have found ourselves in a pretty difficult situation, right, with the COVID-19 pandemic on top of and layering the existing infectious disease threats. So your question is really necessary, and it's important for us to discuss this. So I would just say that at the heart of the consortium's work are the government healthcare workers. I think one thing that the pandemic showed is the gaps in health systems across the world. And that has caused the consortium to focus on government healthcare workers who are providing these essential services for people living with HIV. Building that resilient health workforce allows the health system to respond to emerging epidemics, to prevent, to manage, and to control HIV and other infectious disease threats, and to improve population health outcomes in a durable and sustainable manner. By strengthening and expanding the capacity of healthcare workers, the consortium is helping Zambia to be resilient to shocks and stresses, such as epidemic outbreaks like COVID-19, natural disasters, and violent conflict. But specific to COVID-19, the consortium worked with healthcare workers to bring in all stable patients on the HIV side and provide up to 6 months of multi-month scripting in order to reduce patients' need to return to the hospitals, which could become vectors for transmission of COVID-19. It also increased peer navigators' outreach to HIV positive adolescent girls and young women through mobile technology and virtual means to encourage adherence when in-person meetings were restricted and banned in some cases, and supported community health workers to reach stable patients to check in and ensure there were no unexpected issues when patients were fearful of returning to the hospital. Another wonderful example of how the consortium is strengthening the health system and helping Zambia respond to COVID-19 and other health issues is the work that Morehouse is doing with telemedicine. Telemedicine, as you know, is the remote diagnosis and treatment of patients by means of telecommunications technology, and HRSA has been a champion of successful telemedicine initiatives in the United States for decades. Morehouse University began working on telemedicine in the United States after Hurricane Katrina. And with a large number of displaced people and badly damaged health infrastructure, telemedicine was an innovative way to provide services to those in need. Using that particular experience, Morehouse is collaborating with the Zambia Ministry of Health to create and roll out a telemedicine intervention that will ensure that healthcare providers continue to provide consistent and standardized care to those most challenged without needing them to come into the sites. During the COVID-19 public health emergency, this has mitigated risk and will continue to do so, providing care in the safest way possible by minimizing the need for in-person services and reducing significant transportation costs for patients. I think that, as I reflect on this conversation, I think that, these are the things that we want to build as models, that we want to push as models, that we start to think of the way we provide care in a different way. And I think this consortium has highlighted how easy it has been really to bring the successes and the experiences achieved over to settings that had not engaged in that and really make it work. And it has been working. We're very pleased to continue this work. Back over to you, Mamadi.
Thank you indeed. And there have been so many interesting things that have been a product of us all experiencing this pandemic together. And I see we are almost out of time and wonder if there are any final thoughts you would like to express on behalf of HRSA and the HBCU consortium as well.
Absolutely. I'll just take a few more minutes and share some final thoughts. Thank you. It has been an honor, an absolute honor, and a pleasure for HRSA to work with PEPFAR, to work with the Zambia Ministry of Health, and the Historically Black Colleges and Universities Global Health Consortium to contribute with PEPFAR funds to improving the lives of the Zambian population. Words can really not express just the joy that I feel and the honor and the privilege that I personally feel to even partake in this, to see the testimony that we saw today from a recipient, from a beneficiary, is what it's all about. And as was highlighted throughout our discussion today, the consortium's partnership with the government of Zambia has had immediate and tangible transformative impact on the lives of adolescent girls, young women, mothers, their babies, and others living with HIV. This is really important because as PEPFAR countries are approaching HIV epidemic control, similar to what we are experiencing now in the United States, it is often the most vulnerable populations and those who have had historically limited access to care and that don't feel welcomed into the healthcare system are the ones who are most likely to continue to experience poor health outcomes due to their reluctance to access care. Models and innovations for addressing social determinants and barriers to care need an approach that is informed by the populations themselves and the providers and leadership that have a deep concern and understanding of the importance of client-centered care, which is what this partnership between the HBCU Consortium and the Zambian Ministry of Health has been able to achieve together. HRSA looks forward to continuing this partnership and would like to thank everybody who works so hard each day to ensure its continued success. Thank you so much.
Thank you very much, Dr. Ade, for so well representing HRSA and its work in the United States and the partnership with the HBCUs. Dr. Celia Maxwell, we are grateful for your representation of the consortium on our panel today. I think as I reflect on the experiences and the comments shared today, there are many partnership lessons, such as leveraging the expertise of outside partners, such as the HBCU. And we're hoping that viewers can draw on this to replicate similar successes when developing their own partnerships with others. We want to thank everyone for tuning into today's virtual program, The US and Africa, partnering and innovating to achieve HIV epidemic control and strengthen global health security. Thank you again to our panel of experts for highlighting the US government's health system strengthening investments and partnership with the Republic of Zambia through the HBCU Global Health Consortium. We want to say thank you to our US Embassy team in Zambia and our colleagues in the Bureau of African Affairs and Global Public Affairs here in Washington for your assistance in helping us organize this event. It is through partnerships like these with non-US government partners like the Historical Black Colleges and Universities and the private sector that we can accelerate our HIV response in Africa to help the continent achieve epidemic control and strengthen global health security. Happy Africa Day.